Hello, hi everyone. Welcome back to my YouTube channel. My name is Privah Blacks and I am here to talk about anemia because a lot of health workers have really forgotten about other diseases. They have put their much emphasis on COVID-19 and they have forgotten that other diseases can also claim people's lives like malaria, anemia and any other disease. So I am here for anemia. I really want to talk about anemia, the types of anemia, so that we can become aware of what anemia is and what we can really do to prevent anemia, or things we can see and get to know that someone is suffering from anemia, or what we can really do if at all we notice someone in our family, even before we go to the hospital, that this person is suffering from anemia. Thanks for tuning in. So I'm starting by defining what anemia is. Anemia is a condition where there is a reduction in hemoglobin and red blood cell production in the body. We have different types of anemia, and we have iron deficiency anemia, and this is caused by lack of iron in your diet. Let's say you are eating foods but then they are not rich in iron, which means you're going to get iron deficiency anemia. We have type 2, we have folic deficiency anemia, and this folic acid deficiency anemia, it means you are having food but then they are not rich in folic acid and you are getting folic acid deficiency anemia. That is type 2. We have type 3 as anemia of pregnancy. This one affects anemia of pregnancy, and this affects only pregnant mothers. So it happens when a mother herself is lacking enough blood and she's really sharing the little she has with the fetus. If there is excess fetal demand, it will lead to anemia of pregnancy because the mother is going to share the blood she's having with the fetus and she will get anemia of pregnancy. But we can do some things to stop this. We can take folic acid when you're pregnant. You can also take iron when you're pregnant. You can eat a lot of foods rich in iron, folic acid. You can also take tablets for folic acid and you will solve that problem. So hemolytic anemia comes in when there is excessive red blood cell destruction in the body. It could be due to malaria itself because it destroys red blood cells, or it can be bilharzia, it can be hookworm infestation. So if you have malaria, it is better for you to treat it when it is in its early stages because malaria destroys red blood cells, or hookworm infestation or bilharzia. So if at all you notice that you have malaria or hookworm or bilharzia infestations, seek for medical attention to control hemolytic anemia. So our number 5 is anemia due to blood loss. It can happen to pregnant mothers, especially the ones who are in third trimester. That is when the pregnancy is 7 months or 6 months or 8 months old, and they are experiencing antepartum hemorrhage, or sometimes when they go through labor they get postpartum hemorrhage. They might suffer from anemia due to blood loss, due to antepartum hemorrhage or postpartum hemorrhage. I've said antepartum occurs when someone is still pregnant, then postpartum, it happens when someone has already given birth and loses a lot of blood. Our number 6 is sickle cell anemia, and this only affects people who are suffering from sickle cell disease. So if you're having sickle cell disease, it means your hemoglobin is going to be denatured, or it is funny, it keeps funny, and it produces funny or weak or fragile red blood cells that really break down easily. So if these red blood cells keep breaking up easily, breaking down easily, it means you are going to suffer from anemia due to sickle cell disease, and we call it sickle cell anemia. But we have a lot of ways we can stop this. If you are suffering from sickle cell, you can go to the hospital, you seek. So our number 7 is pernicious anemia, and this comes in when your body cannot really absorb vitamin B12 due to less intrinsic factor in the stomach. We have number 8. Number 8 is known as aplastic anemia, and this comes in when your bone marrow is weak and cannot produce a lot of red blood cells due to x-rays of the bones, or sometimes bone fractures, or sometimes use of chlorphenical drugs, tablets or syrups that weaken the red bone marrow so that it cannot make or manufacture a lot of red blood cells. And remember, when we don't have red blood cells in the body, or when we have a reduction in hemoglobin, it means we have anemia. Causes of anemia, particularly in pregnancy. So it could be iron deficiency, it could be folic acid deficiency, it could be malnutrition, it can also be blood loss due to abortions, or sometimes it can be antepartum hemorrhage or postpartum hemorrhage that really affects women who are pregnant, the ones who have gone under labor, or those who are still pregnant. Sickle cell anemia, bilharzia or hookworm infestation, diseases like malaria, and maybe neonatal demand that leads to anemia of pregnancy. And these other things we can really do to take away anemia at home. But before doing these things, we have to know first, how do you know that you are really suffering from anemia, or you really... Other signs include tiredness. Sometimes you feel like you're too tired. You can get dizziness, you can get headaches, you can also get spoon-shaped nails. If anemia is severe, the nails are always curved like a spoon. Sometimes you can get sores on the tongue, though they are always smooth, but then the tongue is always pale too. Sometimes you can faint. Sometimes you can also get dizziness. All those are the signs and symptoms of anemia. And if you get one of these, let's say the conjunctivas are white or pale, the mucous membrane and the tongue are pale, consult a medical doctor or go to the nearby hospital. Effects of anemia on a pregnant woman. I'm just talking about pregnant mothers because anemia is truly dangerous on people who are pregnant. So anemia affects the baby, it affects the well-being of a woman and the baby itself, or the fetus. So it can lead to a lot of neonatal risks like birth asphyxia, or sometimes neonatal anorexia, sometimes increased premature labors, that is abortion. If a woman gets abortions when they are actually in their third trimester, when the baby is 6 months or 7 months, that is premature. Thank you for watching. Please like my videos, subscribe to my YouTube channel, and if you have anything you want to ask, or if you have anything you want to know about your health, let it be your sexual health, let it be your family planning, let it be anything concerning health, you can as well comment below or tell me your concerns or anything you want me to talk about. I am here to tell you everything. Bye bye.